All right, everyone, good morning. We're having a little bit of difficulty getting this to post up, so I'm going to try again here. So my main purpose today is just simply to prepare you for the final. So I'm just going to hit on some highlights for you. I was hoping to go through the whole PowerPoint again, but that's not going to be possible. So I just want to make sure I at least get the main points to you. So by sections of the chapter, real quickly. Section 1 is going to be the general discussion of maladaptive behavior or the problems that the young people have. So the first part deals with what may cause it, meaning the biological, psychological, or social. And so expect about 3 or 4 questions from that section as to whether or not the doctor or psychologist or whomever is trying to help the kid believe their root cause. The next section goes into developmental psychopathology, talking about how the kids respond to their problems. And so this section deals with the risk factors, the internalizing the problems, meaning they hold it in and lead to depression, or externalizing problems, they act it out. It looks like I've selected about 6 questions from that section. So make sure you look at that, and these are going to be in a scenario form. So be prepared. Like I've tried to send out emails, there will be 50 questions, all from chapter 13. Okay? The next major section after that gets into a general discussion of substance abuse and then a specific discussion of alcohol. It looks like I picked about 3 or 4 questions from the section on alcohol. It's the #1 drug of choice for young people. Typically they binge drink. It's consumed more by males than females. It's responsible for 2/3 of domestic violence, where males are inebriated and become violent within the home. So pay attention to these things. It's a depressant, not a stimulant, so it's in the depressive category. And some of the risk factors deal with they're hanging out with kids who drink or their parents drink. The next category is the hallucinogenic drug category. This is the only category that's not going to be considered physical dependent substances, LSD and marijuana, but psychological dependence. So the person takes the drugs for coping, for reducing stress and anxiety. With the LSD, pretty tragic history with LSD. It's a synthetic drug. They call it a mind-altering drug, psychedelic drug. It has these different terms, but basically it's unpredictable and extremely dangerous. Marijuana, on the other hand, is, most people know, is becoming more and more legal in America, but it still falls in the hallucinogenic category. The hallucinogenic category, by the way, alters perception and modifies hallucinations, or modifies perception, and creates hallucinations. The marijuana, probably more of the modify perception part, not so much the hallucinogenic part. LSD, more of the hallucinogenic part. And so, the thing about the marijuana, it's fat soluble, so it stays in the system longer, and whereas alcohol is water soluble and it passes through the system more quickly. The next category in the chapter deals with stimulant drugs, and stimulant drugs are going to be drugs that increase activity in the central nervous system, so the heart rate's going to go up, and body temperature, energy level. And so some people take different stimulants for different reasons, but pay attention to those things listed. You're going to see cocaine, the different uses of cocaine, how it's consumed. You're going to see in this category ecstasy, and make sure and read, it's just a paragraph on the different effects or symptoms of ecstasy, especially things like dehydration, and tolerance level develops very quickly. Cigarettes, another one in this category, nicotine, the use of any tobacco products. I'd pay attention to the age of onset, which the earlier a young person starts smoking, the greater the risk of having a difficult time quitting smoking. They're doing more damage to their body, their development, and so on. Number one reason kids give for starting to smoke is being introduced to them by a friend, and generally the age at which they start is middle school, somewhere between 6th, 7th, 8th grade, around 13, 14-year-olds, somewhere in that area. And so pay attention to that. I think that's it in the stimulant. Give me a second, I'm just checking my notes for you. The third category in your book is the section on depressants. Depressant drugs are going to decrease activity in the central nervous system. Two different types of test questions here. One is the licit or legitimate drugs, meaning prescription drugs that people can take. And so number one reason kids give for accessing prescription drugs is they get it in the home. The families have these things in their homes and the kids can access it. They share it with their friends, still very serious problem. So you're looking at things like barbiturates, which are used for sleeping. You're looking at tranquilizers for reducing stress and anxiety, but both can be addictive to the individual. The second part of the section on depressant drugs turns to the illicit drugs, meaning heroin, specifically the opiate derivative from the opiate plant, and but also in this category could be codeine and also morphine. And so I'm trying to move quickly and get this to you as best I can just off the top. So, but these are extremely addictive substances, and their specific use would be painkillers and just depressing the system to alter the mood. And while I'm thinking about that, going back to the stimulant section, pay attention to the amphetamines is also in that last category. Because sometimes people take an amphetamine for the purpose of increasing energy, staying awake, or appetite suppressant. But the depressant category is exactly the opposite. The next major section that I want you to prepare for the final, and looks like I picked about 6 questions, is the section on juvenile delinquency. There's levels of juvenile delinquency. I've given those to you in previous lectures, and you'll see it in your book. So just pay attention to those socially unacceptable behaviors, status offenses, and index offenses. So status offenses are going to be against the law due to the age of the child. That's what makes it illegal. Index offenses are crimes against society regardless of age. So it wouldn't matter what the age is. If it's a felony and an adult also would be charged with it, then it's against the law. Those are index offenses. Males are far more likely than females to be adjudicated delinquent. Keep that in mind, and so on. But look at your notes. So again, about 5 or 6 questions from that area. The next section is on major depressive disorder. Looked like I pulled about 5 questions from that section. So we're looking at, I would know the diagnosis or the criteria, 5 or more of the 9 symptoms that have to occur for at least 14 days consistently. Look at gender. Females are far more likely to be diagnosed with the depression. Look at reasons why, like things like ruminating or thinking about this, whatever's troubling them over and over, discrimination, body image. So there's a list there in your book that highlights why females are more likely than males. And also males are gonna, even though they may be experiencing depression, they're probably gonna act out with aggression. From there, that leads to the discussion of suicide among young people and emerging adults. Looks like I pulled about 6 questions from that section. So the discussion on depression leads right into the discussion on suicide, and the reason for that is that's going to be the number one reason given as correlated to suicide is depression. There's a number of other reasons, It's not that the depression causes it, but it's associated with it, correlated with it. There's discussion on females attempting suicide far more often than males, but males succeeding at suicide. I would look at the ways young people attempt suicide. Females are going to be more likely to use a passive approach and therefore do not commit suicide as often, whereas males are going to use a much more aggressive approach and are more likely to complete the suicide. So those are some issues you should be paying attention to related to suicide. A couple other things I noticed that I picked some questions from, and look it up in your book, and that is ethnicity. For instance, the American Indian and the Alaskan Native group, they're high-risk groups. There's a high use of alcohol and isolation and depression among those populations. Another interesting thing is we're talking about adolescents, but the truth of the matter is among emerging adults, the suicide rate triples among that population. So be paying attention to those different things and I think you'll be okay. It's the third leading cause of death among young people. We've talked about these things before. I move into the section of eating disorders, and again about 6 questions. There were 3 different eating disorders in this section, but it starts off really with obesity, probably a question or 2 about that. Obviously an obese child is a predictor of an obese adolescent, an inactive child, kids who aren't getting out and participating in sports, it puts them at a higher risk. But as far as diagnosing eating disorders, the first one and the most serious of the 3 that the author covers is anorexia nervosa. It's a relentless pursuit to lose weight even when the person doesn't need to lose weight. They literally are starving themselves. And so they have to, if they take a certain calories in, they're going to burn a certain calories. They're obsessed with that. And so it's a rare eating disorder. It's less than 1%. And even then, it's highly proportioned to females rather than males. But just a couple of paragraphs, so take a look at that. Anorexia nervosa, the most dangerous of the 3. The second one covered is bulimia nervosa with binging and purging. And so while this one is not as dangerous, it's still an eating disorder, deals with gaining back control. The person binge eats, but then they purge by either use of laxatives or forcing themselves to throw up or vomit, and to trying to get back control and maintain their weight. The third one is simply called bulimia without the binge. It's the binging without the purging, or it's bulimia binging, and so there's no purging. So just pay attention to the test question. It's going to give you the different scenarios. I don't think you'll have any trouble with that. I hope you find this helpful. If you prepare for the test, please pay attention. We have the information posted for you as the date and time of your final exam. Again, 50 questions from chapter 13, no comprehensive questions. I can't think of anything else I need to share with you, but if you haven't taken a makeup test, you really need to get that done, because we're wrapping this up, I think, this coming Monday and or Tuesday, depending on what section you're in. Okay, I'm going to go ahead and wrap this, and that's it.